Hi, I'm Jeff Adam-Spink. I'm on the board of EDRIC, which is the European Dysmelia Reference Information Centre, and as you can probably see, I've been born with upper limb disabilities caused by the morning sickness drug thalidomide. I think one of the principal concerns when you have a rare condition like limb reduction or any other rare condition is isolation from other people with the same condition and the disruption of networks that support those people. In other words, medical expertise tends to be fragmented, tends to be cross-border, tends to be very piecemeal, and therefore generally people with rare conditions tend to get poorly served by national health services in whatever country they happen to be in. So the principal thing for people with a rare condition is to get support from their peers and also to get access to the most up-to-date, relevant and accurate information about their condition, so that when they go into hospital they need their blood pressure checked, or they're going to have a new knee joint put in, or any of those things, that it's done in the right way, in a way that's going to enable them rather than to further disable them. Well, our vision is to create what I like to call a super network. In other words, we've got these two big flywheels. We've got one of the users or the patients or the people affected by the condition, and the other is of all the experts in that condition and expert knowledge around that condition, and then we bring the two together and get them to interact, so that a person who goes into a clinic in Greece should get exactly the same advice as a person who goes in to see their doctor in Finland, but that has the same medical problem. Or the person that needs a kitchen adapted in Oklahoma has exactly the same advice available to them as somebody who needs their kitchen adapted in Tokyo or anywhere else in the world. I think for us, our vision is to make sure that we have the most accurate, the most up-to-date and the most relevant information available to everybody affected by that condition. And that's a huge thing, but we're helped by something called the internet, because especially with the development of social media, we can very quickly form connections across the globe and quickly and quite accurately pinpoint centres of excellence, experts in the field, relevant patient or user groups, and bring everybody together under one umbrella, one multilingual umbrella. I think one of the most exciting things is the fact that we've launched DysNet, which is our online community, and we are now launching a Rare Connect part of DysNet, which means that all of that brilliant information that we've been able to gather together is going to be available in the 5 major EU and arguably world languages, which is English, French, German and Spanish and Italian. "2012 is a big year for EDRIC because we've already launched DysNet all over the social media, on YouTube, on Twitter, Facebook, LinkedIn, Pinterest, Google+, you name it, we're there. We're also launching Rare Connect, and that has a DysNet community as well, and that's going to be available in the 5 major languages of the EU. And we need also to grow the membership of EDRIC. We need to group together as many organisations of dysmelic people together under our umbrella. So we're going to hold a meeting at the end of September, either in Hungary or Sweden. We haven't quite yet finalised the destination or the venue, but our aim is to really enthuse the people affected by dysmelia by our vision, and our vision is to get everybody talking to everybody else. I mean, our strapline is EDRIC, it's time we came together, and that's really what we're all about.